This is Dr. Scott Smith, and this is the second series on the topic of vocational rehabilitation. The topic of interest today is family involvement. There are multiple factors that will come into play or intervene related to successful vocational rehabilitation. We will discuss those today. These factors are age, education, severity of disability, presence of skills, and also work history. With all these factors, there are no other factors that comes into play or that are more important or more prevalent for successful rehabilitation than family involvement. Its importance cannot be minimized. One's family may get involved through several ways, such as travel to and from appointments, participation in meetings, planning, and also discussion about how rehabilitation will affect family life, particularly at the home. Who is involved in family life will, of course, depend upon an individual's family structure. Everybody has a different set of situations. Everybody's structure varies. You may have mom and dad, mom only, mom with partner, dad with partner, with or without siblings, alongside other situations. This may also include boyfriend, girlfriend, or close, romantic, or even a non-romantic friend or partner. It is important for family involvement to occur early within the rehabilitation process. However, admittedly, some families may be strong or perhaps not so strong before even a disability occurs. Family involvement occurs primarily in three locales or places. One, in the formalized rehab setting, the home, and also in the community. Formalized rehabilitation settings may involve a hospital, a treatment center, or even follow-along care such as the therapist's office. In-person involvement may or may not be needed, depending upon the situation. At times, a family member simply needs to sit alongside another family member, listen, provide support, and other dialogue. It's always important to be supportive. Other times, simply being in a waiting room may be beneficial. At home, family support is additionally vital. Very bluntly, simply being nice and understanding that someone with a disability may take longer to complete a task, even an everyday task, may need assistance in completing a task, will be beneficial. Understanding the need for home modifications, such as architectural changes, designs, or reassignment of home chores, may also be needed. These are all very important. Family support may also occur within the community, and this will be a valuable tool for rehabilitation. This may include providing transportation, giving someone a ride. It may also be more of an advocacy role for the family member in community settings, particularly if a person with a disability cannot advocate for themselves. However, while family support is valuable, it is important to consider the following points, particularly when working with rehabilitation providers. I have seen all of these situations occur in the scope of rehabilitation planning. Let's discuss some of those. When in a meeting, do not laugh when rehabilitation goals are being discussed. This may be relatively simple. This is not only rude, but offer the rehabilitation provider an opportunity to lead into a plan or goal. Seek understanding as opposed to criticism. As a family member, feel free to offer feedback, but avoid declarative statements such as, "That will never work," "That's silly." Rehabilitation is a developmental process. Large goals can only be accomplished through a series of small steps. Offer constructive feedback, not criticism. This includes criticism of the family member or even the rehabilitation provider. Constantly evaluate if your comments enhance, facilitate the rehabilitation planning, or simply serve as an opportunity to get something off your chest or shoulder. Don't take over the meeting. As a family member, you are a loved one for someone with a disability on a constant daily basis. However, realize your knowledge can be accompanied by the skills and knowledge of others on the rehabilitation team. As a family member, be willing to learn and listen. When we listen, we gain knowledge, but we also should not take over from others. We only tell others what we know. I am offering a podcast and YouTube video series on the topic of vocational rehabilitation. While this series may be of interest to several individuals, I am particularly focusing the series for parents and also individuals with disabilities themselves. It is the intention that this series will both answer questions and furthermore prompt questions from parents of children with disabilities, individual disabilities themselves, and also teachers and educators about the potential that vocational rehabilitation may assist persons that may have a wide range of disabilities to transition to the workforce or even an educational opportunity prior to entering the workforce. Be sure to check out my website, www.strategy365consulting.com. Again, this is Dr. T. Scott Smith, vocational counselor.